My life before the surgery was very difficult, very stressful. I was going through a lot of depression and everything with the weight. After dealing with and talking with my family doctor, because of my health issues, I've had 4 major back surgeries and a neck surgery. I was unable to do major exercising and everything. So she finally put on the table to me about having the gastric bypass done. It was a very big step. I went home, talked to my husband about it, and we went on the internet, read about it and everything, and then I came down to a support group. I just came in, sat in. They welcomed you to come in and sit in on the support group.
Most patients who come to us have reached the end of the road in terms of weight loss efforts, medical weight loss efforts. Many of these patients have chronic conditions, such as diabetes and high blood pressure. We have a weight loss program, we just don't have a weight loss operation. So when they come to us, we encourage them to change their lifestyle, to change their normal habits. For example, we suggest very strongly to them that they adhere to an exercise program, that they go to the gym or take some form of exercise every day. It's an aid to a lifestyle change as well as everything else. What we do with the various different procedures is we give them a tool so that they can alter their abnormal eating behavior with these tools. And we're very careful to tell them that unless they comply, they may not be successful in the long term. They certainly will be successful in the short term. If you look at the numbers, 85% of patients who have weight loss surgery, particularly gastric bypass, are successful long term in keeping most of the weight that they've lost off permanently. About 15% of patients will put some or all of their weight back on again because they revert back to the old habits that they had before they had their surgery. And they stop exercising or eat junk food or graze all day long and so on. So they have not learned to alter their behavior.
I tell people that every day is a challenge. Every day you have to do this for yourself. And you not doing it for anyone else, but just for yourself. And you have to constantly attend the support groups are very, very important, and it's a family, and exercising is very important. I feel fabulous. Every day I get up, I'm thankful. I was a diabetic type 2. I'm no longer, in January of 2011, I was no longer diagnosed with diabetics type 2, and I feel fabulous. I'm able to go out, I walk, I ride my bike, I exercise a little bit, I do Zumba, love Zumba and everything, so it's been fabulous. The biggest plus is that my health is a lot better. I am just so happy, and I look in the mirror now and I see a different person, but I'm healthy. And that's the biggest plus of all, is that I've been given another chance.